So very quickly, we're all aware of the second COVID wave that has devastated India, especially the cities. The second wave contributed to 16 million cases just in the last 2 months, April and May. And you can see it was 4 times as severe as the first wave. But, hitherto, it was considered as the urban phenomenon. But the second wave has surged in several rural districts as well, especially in UP and other places. We are hearing about how the numbers are going up. And unfortunately, the rural areas are ill prepared to handle this kind of a surge. So many of us were very concerned, and we sort of looked at 4 key challenges in our rural areas. First is the absence of ICU beds in area hospitals, sometimes even in district hospitals in new districts, an acute shortage of medical staff, such as intensivists, pulmonologists, and so on. Even the existing medical staff need to be trained on COVID protocols as things are changing dynamically. And finally, we needed, there's a sort of ad hoc disaster response in many rural areas across the country. We need a more systemic approach. So we basically came up with some thoughts and ideas around how to help in this situation. First was this idea of creating a 10-bed ICU in every rural district of the country. And I'll tell you a little bit of how we came here. But moving forward, the second thing is to deal with acute shortage of medical staff. We came up with a program of Doctor Connect, basically using telemedicine in order to help get specialist doctors like intensivists and pulmonologists and anesthesiologists from India, from the cities, from US and UK. Many Indian doctors, from Telangana, we have talked to. They would love to come and help us. We'll talk a little bit more about it. So that's the Doctor Connect program. The third thing is the training module to teach COVID protocols and the ever-changing scenario. That is the third module. And lastly, of course, a robust technology platform for pandemic management. So very quickly, I'll share with you what the program has come up with in conjunction with the Telangana senior officers. So the 10-bed ICU setup itself, I have to say here, the district collector of Naranpet, Srimati Harichandana Garu, had already worked out many of these plans, and she wanted to launch ICU beds in her own district hospital. And so we, in fact, built on top of her plans. I'd like to share that with you. So this is a full-fledged ICU unit, not just with ICU beds, but ventilators, both hybrid ventilators, both invasive and non-invasive type, oxygen concentrators, which had become the big thing about 5 weeks ago, oxygen cylinders, 25 oxygen cylinders for every 10-bed ICU, infusion pumps, the multi-channel monitor. This is the entire equipment set we are providing to these hospitals. And I'd like to also say that these are premium equipment by good premium vendors being procured by our NGO Nirman. We are going through multiple vendors. We are picking the best quality for these hospitals. And moving forward, the Doctor Connect program, this is where we heard from your government officials as well as in many other states that we have a shortage. Even if you gave us a 10-bed ICU infrastructure, we don't have the necessary specialists in rural areas to help our severe patients. So we've reached out, especially in the US and UK and also in India. The response has been phenomenal. There are innumerable doctors, especially Telugu-speaking doctors who we need for Telangana and Andhra Pradesh, and they are ready to come forward and help us. We have talked to API, the American Association of Physicians of Indian Origin, as well as BAPI in Britain, and we are working with several groups. Very good progress. They are all ready to come and help us. There is an outpouring of support from especially the Telugu doctor community in the US, and we are able to bring this to our 10-bed ICUs. The next, of course, is the training module. Here, while we have put up some very good content from Johns Hopkins and Harvard, as well as Vellore and other good institutions, what I'd like to say is it is not enough. The MOOCs experience teacher has taught us that just by putting out good material is not enough, and ask doctors and nurses to empower themselves. So we are going to conduct live training, of course, with good curated material like what we are showing you, pause, discuss issues, case-based training, as well as actual discussion among the various doctors and nurses, because this is a very dynamic pandemic. It's not as though anybody knows all the right things to do. So this, again, we are working with Swasth Alliance, and they're going to help us. There's a good team at Harvard as well, which is working with Swasth Alliance on India-specific protocols and India-specific training. And lastly, the pandemic management technology platform developed by this team in Kerala, Corona Safe, has done a very successful implementation in Ernakulam. And it has everything from real-time monitoring of ICUs, ventilators, oxygen, which had become such a huge issue in India, not able to get the right amount of oxygen to the right hospitals, to visualizations of capacity. You will know exactly where the ICU beds are and which ones are empty, which ones are filled up across the state in the various districts. All this is currently running. And we have done demonstrations to the IT team, to the command and control team, and so on. The integrated telemedicine platform is part of Corona Safe, and it will help us connect the Doctor Connect program, both on the clinical PHR, the patient health record, as well as on a video interface. Something very simple so that our doctors can actually use it. It is as simple as one doctor, maybe in the US or UK or in one of the cities in India, connected or attached to a hospital so that they work with the local doctor and nurse and help the 10 patients that we have in their 10 beds. The foreign specialists are not going to prescribe. Obviously, they're not going to do any procedures. It is the local doctor. This is a tele-advice. The local doctor will do the prescription and the procedures and the various things for our patients. And lastly, dashboards at a state level showing exactly case loads, showing all the details of oxygen, beds, people, equipment. All of this is a consolidated dashboard, which can actually give you a very good idea for good decision making at the state level. And of course, this is completely free and open source. There is no proprietariness about this. Even without our team, you can take this forward and use it. With that, let me talk a little bit about the structuring of this private-public partnership. This has been only about four and a half weeks old. But, I have to say, from day one, Sri Jayesh Ranjanji, Sri Mahesh Babaji, Srimati Divya Devarajan, and others have been involved in actualizing this entire program. Nagesh, Gauravaram is here, Bharani, and everybody. And we came up with some very simple structuring for success of this PPP. The 10-bed ICU will provide the ICU equipment, the technology platform, Doctor Connect, and training. So we are providing the capital expenditure, procuring the equipment, and handing it over to the various hospitals. The government will in turn supply us a building, medical staff, and ongoing, they will take care of the operations and maintenance of this. A very simple way to look at it from a financial point of view, CapEx is managed by the 10-bed ICU team, and the operational expenses and running of the system is managed by the government at a high level. This is what the overall team here came up with. And the PMU will oversee the proper implementation and support. At this juncture, I would like to invite Sri Jayesh Ranjanji to share with us, because you were there from inception, some ideas about this program as well as thoughts for how to make it successful.
Srikanth, looks like JSG is in a meeting. I think
Maheshji, you were also there from the day one. Can you share your thoughts and ideas about how to make our program successful, sir?
Good morning. I'm audible, Srikanth?
Yes, yes.
Okay. First of all, I'm grateful to Khosla Foundation for coming forward. Honorable Minister for MAUD, KTR Garu, Khosla Foundation Chief Vinod Khoslaji, and then the man who has spearheaded this entire project, Srikanth Manduni, then Nagesh, Raj Pakala, then our collector of Narayanpet, Harichandana, then Bharani Garu, and all the team members. I think in 1 month, a lot of work has been done. And we can see today now that in 38 area hospitals in Telangana, today we will be having this 10-bed ICUs, plus I think 29 in Andhra Pradesh. And recently we had a talk with Maharashtra also. So Maharashtra is my native state. So there also this project is being taken now, 34 districts. So it's going on really well. Actually, in my, I still remember that in my childhood, my mother used to recite in the evening, Shubham Karoti Kalyanam, Arogyam Dhana Sampada, that health is wealth. That now everyone has been realized because of this pandemic. And especially we are facing the problem now in rural areas because of sometimes the infrastructure, especially everyone, when the recent wave was at its peak, everyone was asking for the oxygen bed, and because of that shortage, now then people started searching for ICU beds. Then it was made online and made available. But now we can see now slowly cases are getting declined. So that same demand may not be there today. But it's always been said that sweat more in the peace, less you have to bleed in the war. So we have to prepare now for the third wave also. I think this is the right step taken by all the like-minded people. We have come together, have donated amount for around $40,000 for one unit, and it will go a long way. This project of a 10-bed ICU definitely will be a game changer in a rural health scenario. We always talk about decentralization of health services, and in that decentralization, I think this health service making available at the district headquarters, especially the rural districts where infrastructure as such in the government hospital may not be of that level, but the doctors are available, or the district collectors are having power to take doctors on the contract basis. So there, this 10-bed ICU project will be definitely helping, at least in the third wave and end of the second wave. So once again, I congratulate all the partners who have joined hand and to make this project successful. My best wishes to everyone, and I will be there. Since beginning I joined, I will be there till this project is taken to the logical conclusion. Thank you, and good day to all of you.
Thank you. Thank you so much, Mahesh ji. So to move on to the next item, the most important aspect is our donors who have come forward to fund this entire project. I would like to take a moment, take you through the donors. And while we are doing that, I'd like to stop and tell you a little bit about the district collector of Adilabad, Srimati Sikta Patnaik. She was on maternity leave, but she continued to engage with our team, the 10-bed ICU team. Nagesh was making calls and he was talking to her. She was talking to us from, all through the maternity leave. And so we thank you, Srimati Patnaik, for your support for our project. Nanda and Susan Vora of Sugarland, Texas, near Houston, they were very keen to fund Bhopalampalli. They are from that place. And not only did Nanda and Susan fund this, but they also helped us in the Doctor Connect program. So thank you, Nanda. Thank you. I want to stop for a moment to recognize ICIA. Bharani, our old president, runs ICIA. They were able to fund 5 of our hospitals. Okay, and so we thank you. They brought in many companies from the Hyderabad Software Enterprises Association. So not just commodity, but you will see many hospitals were funded with the I would like to thank United Way of Hyderabad, Rekha Srinivasan. Thank you so much. They funded 3 hospitals. You are a big institution in the United States, and I see you making inroads in Hyderabad and India as well. Thank you so much for your help. To Salesforce.com. Narayanan, entrepreneur, VP, P. Varaprasad Rao, he hails from Mancherial, and he went about meeting the Forest Contractors Association, the Pipe Manufacturers Association, and a number of people to raise the 30 lakhs needed for the ICU beds in Mancherial. He met with the district collector. He showed such interest in getting people of Mancherial to fund this. So thank you very much, sir, for your efforts. Well, I'm having a bit of a trouble, but let me just speak. I know it is Vinod Khosla out there, and there is the Narayanpet district. Let me just say, as soon as the oxygen problem erupted in Delhi, Vinod tweeted out there saying, I'm ready to finance hospitals that need oxygen right now. And there were thousands of people who contacted us. There were 20,000 retweets of his message. And in some sense, this project got started with all that energy that got created. I got connected to Nagesh and Raj Patala because of these tweets, and friends started connecting people to solve the problem. And I would say Vinod has donated, I don't know, about probably about $20 million already for the various causes. And he continues to make significant contributions. And he funded 4 district hospitals here in Telangana. He also funded the PMU operations here in Telangana. Thank you, Mr. Khosla. By the way, just to remind you that Narayanpet, we are going to launch there shortly. So stay tuned. We are going to go to Narayanpet in a little bit. Again, there was very innovative, kind of funding. For instance, Vox AI, Sunil